Chapter 50, Nursing Care of the Child with an Alteration in Behavior, Cognition, or Development. In this chapter, we're going to talk a little bit about some of the impacts of mental health on the growth and development of infants, children, and adolescents. We're going to talk about some techniques to evaluate mental health in children. We're going to identify some appropriate nursing nursing assessments, interventions, and we're going to distinguish between some of the disorders. So, mental health issues, they're calling it the new morbidity of children. So there's issues with development of behavior, such as mental and behavioral disorders, eating disorders, mood disorders, anxiety, abuse, violence. And as you can see in the slide, and it's probably a little bit old slide, is many children with mental illness don't receive treatment at all. And so there's a problem all over the country, and it's so extensive that the U.S. Surgeon General has published a national agenda for action on mental health with children. That includes public awareness of these illnesses, to develop services for prevention and treatment, recognizing these needs, eliminating racial, ethnic, and socioeconomic disparities when it comes to mental health services, improving the infrastructure for support, coordinating care, offering more care, training frontline providers to recognize and manage some of these issues, and then quality control. When we talk about those at risk, is kids with emotional issues. We talk about firearms, reckless driving, substance abuse, sexual activity. There's a lot of risk factors involved with mental health. What influences is obviously biologic, genetics, environment, the family interactions, temperament, stress. When kids have stress in some form, some of them will either have some type of dysfunction. They could regress, and then those regressive behaviors could continue into a mental health concern at some point. Some ways to handle behavioral health is to set limits, and then holding them responsible, not arguing, bargaining, consistent caregivers, consistent routines and rituals, remaining calm, redirect their attention sometimes, ignore inappropriate behaviors, and then praise their efforts. And we tend to not use restraints in these cases. Learning disabilities, I'm just going to touch a little bit on that. So learning disabilities are children with dyslexia usually have more learning disabilities. And then if they have a chronic illness, it would increase 2 times. Intellectual disability, I'm only going to mention that usually problems with intelligence really develop before 18 years old. And these are the kids that long ago they would put in homes. They formerly termed this mental retardation. So we've gotten away from that, and now they are streamlining into schools. They don't really know why it happens. It could be some prenatal errors in the CNS development or some type of injury pre, post, or perinatal period. And this just gives you some of the ranges of mild, moderate, and severe emotional disabilities. So again, early intervention is important. I'm going to talk a little bit about autism. Autism is a spectrum of disorders. Some of the warning signs are if a child's not babbling by 12 months, if they're not pointing or using gestures, no words by 16 months, no 2-word sentences, and then any type of losing their social skills at some point. So like I said, it's a spectrum disorder. So not every child you see will have the same signs and symptoms. They call it pervasive developmental disorder. and it usually is onset in infancy or early childhood. There's mild, so we see Asperger's syndrome sometimes, to severe. How we would recognize it would be children not meeting their milestones, or meeting their milestones and then losing them. So losing those acquired skills. They don't really know what causes autism. It could be genetic makeup, the brain abnormalities, virus, toxic chemicals. It's really not, there's a lot of research going on in this area, but they haven't really pinpointed it down. And when we see autism spectrum disorder, we see social interaction problems, communication, stereotypic behaviors. Many are intelligently disabled, but then some are very gifted. So like I said, it's a whole spectrum. There's no medications or treatments to treat this, so optimal functioning within whatever that child, what their limitations are. Children with autism like to be in a structured environment. And then some parents do use some complementary alternative medical therapies, herbs, vitamins, things like that. It's really important when kids come into the ER that are autistic. It's always important to know this, and usually the triage nurse would let you know, or if a patient is well known to the doctor's office, they know. And so this is not the child where you want to rush in with 3 or 4 people, because that would just stress them out more. Sometimes putting a gown on because they're very sensitive to different materials, a blood pressure cuff, things like that. So you really need to assess the child and their needs and what works for them. And the parents are really good a resource, because they can tell you, oh, well, you know, if we turn music on, he'll be okay, or things like that. But it's not somebody that you want to just rush in there, because we tend to do that in hospitals. In the ERs, you know, everybody kind of goes in together to get the story once, but you really want to decrease the stimulation. Being in a lobby with a lot of kids is not going to be good for them, so they try to get them in a room as soon as they can. Let's see, a lot of research in this area, like I said. Emotional support, that's one of the biggest ones. Emotional support, and then probably respite care, so getting them some services, because sometimes if they are moderate to severe autistic, it can be very stressful on families. So education to the family, and coming up with a treatment plan is really important. Rigid, unchanging routines, sometimes that really helps them. And like I said, respite care and referrals, and then positive feedback. Parents who work with autistic kids can be pretty amazing to me. ADHD, so attention deficit hyperactivity disorder. It's a common neurodevelopmental disorder, usually around school-age kids. And these kids have a problem with inattention, impulsivity, distractibility, and hyperactivity. So it's hard for them to sit down, pay attention, follow the class, what's going on. There's a disruption in their learning abilities, socialization. And so this is very trying to some teachers, parents, things like that. So there's a lot of things that get put in place to help them while they're in school or at home. Sometimes they have a comorbidity with another type of issue. They don't really know what the cause of ADHD is, but they think it could be an alteration in the dopamine and norepinephrine neurotransmitter system. So usually the symptoms started before 7 years old, with the, just not being able to sit down, pay attention. And then they get frustrated. They can have peer rejection. They can have emotional outbursts. They just get very frustrated because they can't do what other kids can do. Sometimes they have their poor metacognitive abilities, so organization management, so time management is harder for kids with ADHD. There's inattentive combined, and then there's Tourette's. So Tourette's, I'm not going to talk a lot about Tourette's syndrome, but it's motor tics and vocal tics, and then it can be controlled, some of it with medication. And Yuko will go into a lot of obsessive compulsive disorders in psych. Eating disorders, Yuko touches on these, but we'll just kind of touch a little bit, is pica. Pica is around 2 to 3-year-olds, and it's an eating disorder in which they ingest non-nutritive materials, so paint, clay, sand, things like that. Anorexia and nervosa and bulimia, so we see this in adolescents, although sometimes they can be younger children, but anorexia is the dramatic weight loss because they stop eating. Tons of physical exercise, and then bulimia is that cycle of normal food take, but then binge eating, purging. Some of the complications of these two, anorexia and bulimia, would be electrolyte imbalance, decreased blood volume, arrhythmias. Even from the vomiting, they could have an esophagitis or rupture of their esophagus, losing the calcium on their teeth, menstrual problems, and then there's a high mortality rate for anorexia and nervosa. So there's a lot of specialty areas across the country where people can go for these diseases. I remember a specific case in the hospital. She was 18 and she refused to eat, refused medications. And the doctors wanted to put a feeding tube in and do all these things, but she was 18, so she could make those decisions. Her father wanted to get power of attorney because he felt that she wasn't making good decisions. And when they did brain scans, they found that a lot of her gray matter was deteriorated from the lack of nutrition and stuff. And so they were finally able to consider that she was unable to make these decisions. And the father got power of attorney, and she was sent to an intensive anorexia facility I think it's in Colorado. I don't know what the outcome was, but that was an ethical dilemma because she was 18. And so the ethics committee, there's ethics committees at hospitals, and they met and decided on the ethics committee, it's physicians, lawyers, psychiatrists, nurses, doctors, things like that. And they all come up with a recommendation, and then the physicians make the final decision. But they felt like she was not able to make decisions any longer. So, and I had seen her when I was up checking on students, and she was walking in the hallway and she looked like a skeleton. And they felt like her potassium was getting dangerously low, which affects the heart, and that she was going to code, and they didn't want to code her. They were just sort of broke all the ribs and everything. So they were able to intervene and got her to a higher level of care. And this just tells some differences. So complications, we kind of went over these. Obviously, death is one of them. Suicide, we talked a little bit about suicide. Screening tools for depression are important. One of the Healthy People 2020 goals is to reduce suicide attempts. So again, it goes back to the first part of this chapter, where recognizing mental health disorders in children, getting them care. There's truly only 2 places in Tucson that children can go for mental health care, and that's Palo Verde Hospital, which is over by TMC, and Sonora Health. And they get overwhelmed with people. The same problem happens in Phoenix. Although they have more facilities, they also have more people up there. So there's just not enough specialized care for kids with any type of a suicide or a mental health problem. And so screening factor or risk factors would be, change in school performance, losing activity, involvement, hopelessness, and then any thoughts about suicide. We do suicide screenings on every patient that comes in the ER, and I'm sure they do it at physicians' offices too. And one of the biggest things, if somebody admits to you that they have suicidal ideations or homicidal ideations, is to inquire if they have a plan. Typically, we leave these conversations for the psychiatrists that come in to see them, but having a plan is, somebody is a little bit more serious. And so getting them screened and get them the help is important. So about abuse and violence can have a significant effect on children. And So we talked a lot about child neglect and abuse, emotional abuse, sexual abuse, things like that. And if there's a delay in treatment and changes in history of trauma, then that can also all suggest child abuse. We went over some of those signs and symptoms and things to look out for. Munchausen syndrome is something we mentioned, and I know Yuko talks about that in OB, or excuse me, in psych, but we talk about Munchausen by proxy. So Munchausen is a disease where somebody wants to be ill and they want to be in the hospital and they want to have tests and they want to, do everything. They want attention. And Munchausen by proxy is typically child abuse. And so the parent is the one who creates these physical, psychological symptoms, and they're meeting their own psychological needs by having an ill child. So getting attention, calling up their friends, we're in the hospital event, things like this. I've seen a couple cases of this over the years. One mom was bringing in her child and saying that she had blood in her urine. They did a urine test and it was negative. And so she asked to do another test. She went in the bathroom with them and they felt like she was pricking her finger to put blood in the urine so that the child would get treated. Another case I saw was a mom giving the child Benadryl and then her being sleepy all the time and keep coming in. They want tests done, they want scans, they want the more the better for them, being admitted to ICU, things like that. So it is a form of child abuse and it is something that we report. So getting the history, we see kids who sometimes if they have a problem, parents will not give them the medication, so they get sicker, and they just want more and more tests done. And then substance abuse often begins before the age of 20, and so we also screen for this too, and you'll learn more about that in psych. And so here's some of just the warning signs of Munchausen that I went over. So symptoms that don't make sense, physical and laboratory findings don't fit with the story. They don't have medical records from anywhere. They go to different hospitals. Now with the EHR and some hospitals are linked, it makes it easier. Leaving hospitals, not accepting the diagnosis, things like that. Okay.